Once again, welcome to everybody, and thank you, everyone, for joining us, taking time out of your evening to make time for this very meaningful program. First of all, I want to thank our co-sponsors, and both individually and organizationally, Nina Henry from JCFS and Wendy Singer from No Shame on You. Additionally, obviously, this program is in recognition of Mental Health Awareness Month, which is the month of May. And beyond that, this actually is an initiative from a show based in Montreal. The show is called TBDJ, Tifereth, Beth, David, Jacob. And this show in Montreal, a number of years ago, this is now the fourth year of this really North American, nationwide, including Canadian event, which in conjunction with Mental Health Awareness Month, they organize and encourage shows all across North America to host mental health awareness programming in their communities. And our show this year is participating, and we're proud to do so. It's in conjunction with, sponsored by the RCA, the OU, YU, and many other institutions as well. And it's our privilege for our program to host Nina Henry and Wendy Singer. Before we jump in, I want to take a chance to introduce both Nina and Wendy. Nina Henry, she's to my left, so we'll go with Nina first. Nina Henry is an LCPC. For those who don't know, that stands for Licensed Clinical Professional Counselor, and also a CADC, which is an addiction counselor of sorts.
Certified alcohol and drug counselor.
Very good. And she's also an addiction specialist at the Jewish Center for Addiction, which is a program from the JCFS. She has been working in the addiction field for more than 25 years. She's currently based in Skokie, Illinois. She received her Master's of Counseling at Northeastern Illinois University and was certified to provide addiction treatment services by the Illinois Certification Board in 1991. From 1995 until the end of 2014, Ms. Henry supervised Recovery Point, the substance use program of Community Counseling Centers of Chicago. Previously, Nina was the senior addiction counselor for the outpatient addiction treatment program at University of Illinois in Chicago. And prior to that, Nina was an addiction counselor at Evanston Hospital, the Chapman Center. Since 2010, Nina has provided mental health first aid training. She is the project leader for the Training of Leaders Committee, convened by the Illinois Certification Board to increase participation of treatment professionals in the addiction field, and also a proud member of our Chicagoland Jewish community. Wendy Singer, who I actually have known her, more likely she's known me or my family for much of my life. Wendy has dedicated her professional life to training tomorrow's leaders, social justice, and character development as a nonprofit professional. Before joining No Shame on You, Wendy worked as a director of education at the Illinois Holocaust Museum. Prior to that, Wendy worked for the JCC Chicago, where we crossed paths. And Wendy's 18 years at JCC Chicago, she focused on youth programming, summer camps, which I benefited many years of my life, teachable moments, and mentorship. Wendy is a builder, and she has conceived and grown programs to record enrollment from Hyde Park to Wisconsin. She has achieved success through creating and leading internal and external partnerships. In her last role, running the North Side region of JCC Chicago, she oversaw regional sports, aquatics, children's enrichment programming, 2 day camps, and an overnight camp. Wendy is a graduate of Indiana University and has a master's degree in nonprofit management from Spertus College. Wendy also resides in Skokie.
Right up the street from your shul, actually. I drive past almost daily.
Oh my gosh, you are very lucky. Or we are lucky. You got past. Okay. So we're going to jump in. We're going to start with a question first for Nina, and Wendy, you can follow up. I think a lot of us have heard of both the JCFS and No Shame on You, but we may not be familiar with what exactly these organizations do for the city and what service they provide. So just as a word of introduction, would you mind giving a brief background, what programs and services both Nina, what JCFS provides for the Chicagoland Jewish community?
Well, first of all, I want to thank you, Rabbi Myers, and everyone on the call here for inviting Wendy and me to be here tonight. It's very exciting to be able to share with you. So JCFS, which used to be called Jewish Child and Family Services, and one of the reasons they changed it to JCFS is they kind of wanted to signal that it's not just for Jewish folks. In other words, we really serve the whole community. We do so many things. It's basically a behavioral health organization. We work with folks throughout the lifespan, everything from early childhood development and counseling, working with families of young children. We have a therapeutic day school. We have a huge and really vibrant program for people with disabilities, both developmental and some physical disabilities. We also have a really robust counseling program both in the city, in Skokie, and up in Northbrook at our Kirsten facility. We have a chaplaincy program, which works in hospice care and works in the local hospitals. We have, I think, I'm not actually sure how many chaplains we have now. I think about 6 or 7. And we also have some Russian speaking services. We have a career counseling program. And there's probably more, but I'm going to talk now about the department that I'm in, which is called Community Services. And Community Services is a program or a set of programs that reaches out into the Jewish community. So our focus is the Jewish community. And we do programs in synagogues. We do programs at places like the JCC, at CJE, which is the Services for Elderly Jews, and Ezra and other Federation supported programs. And what I do personally, in addition to being an addiction specialist, I'm also a mental health educator. So the 3 primary things I do is programs like this one, which we kind of put under the heading of community program, which is not for professionals necessarily, though some of you may be professionals. And then I also do a lot of professional training. I do, like sort of widespread professional training through our Professional Training Institute. But then also I might go, for instance, I recently did a program for Compass, which is a program that specializes in treating young adults and teens. So I've done professional training of that nature. But the thing that I think most concerns the folks that are on this call tonight is what's called information and referral, which means if you have a friend, a colleague, a relative, a loved one who seems to be struggling either with a substance use or mental health problem, I'm going to put my information in the chat before we end the program tonight, but you can call me and say, Nina, I have a 27-year-old nephew who seems to be struggling with substance use, and I'd like to find out where I can send him or her or whoever it is for treatment. And I've gotten calls from all over the country. In fact, from all over the world. I've gotten calls from Canada, Israel, even Luxembourg, if you can believe it. And I've placed people in not just the United States, but also outside of the United States, although mostly, I have to admit, it's mostly local. And so that kind of is a large nutshell in which I'll tell you about myself.
Thank you. Thank you. Very interesting. Wendy, please feel free to introduce. I know, no shame on you. I'm sure many of us have heard of it, but probably not. Don't know exactly what's going on behind the scenes.
So I'm also going to share a little bit about my personal mental health journey just for a minute or two, because it ties into how I got connected to No Shame on You. So I was 24 and I experienced for my first time, I was in a job where the role changed several times and I was trucking along doing the best I could. And I started experiencing anxiety where I couldn't sleep at night. I was ruminating about different projects and I was feeling very uncomfortable and I wasn't really sure what was going on. Growing up as a kid, I had a great childhood, normal bumps and hiccups here or there. And sometimes I would get stomach aches or, worry about different things. But really, when I was 24, I started experiencing these intense anxiety to the point where I got panic attacks for the first time, where I would feel a hot sensation in my face and my neck. And it was scary because I did not know what it was. I never talked to anybody about who had that kind of experience. So I felt very alone and scared. And that's when I was diagnosed with generalized anxiety disorder. I thought that my body was broken. I thought that I was never going to come back during that period. I also got pretty depressed at that time, which was the first time ever for that. I'm generally, as some familiar names on this call know, I'm a positive person. I love life. I love doing different activities, doing things, and I really went into my shell and got really blue. I left that particular job, and I thought that I remember thinking I was going to move back to Pittsburgh and live in my mom's basement and work at the video store on the corner. That tells you how old I am. Where, I would be there for the rest of my life. Shortly thereafter, I was able to find a therapist, and I was able to take some medication. And within probably a week of doing those things, I started to feel better and things started to lift. I've had a vibrant career in the Jewish community. As Rabbi Myers mentioned, I worked at the JCC for 18 years. And then I had the incredible opportunity of working at Illinois Holocaust Museum, which whatever I do in life has to be something that I'm extremely passionate about. And the mission aligned exactly with what I wanted to do. I was trucking along with my first year on the job, feeling more anxious, but also embracing it, that when you do something for the first time, it's going to be uncomfortable for a good year. And I remember just saying, I'm embracing it, a first time for everything. And here we go. Fast forward to about a year after that, so almost 2 years into the job, the pandemic had hit 9 months earlier. And in my mind, I was not going to fail at this job, and I was going to do whatever it takes. And also my kids were being homeschooled, and we were trucking along. At that time, it was hard to balance. I remember there was a New York Times article that came out right when I was experiencing the height of it, that was called The Primal Scream. And it was about moms screaming into the phone, trying to manage their kids and work-life balance and everything. And I was working nonstop and also trying to take care of one daughter who was younger and really needed a lot of hand-holding. And my other daughter has always had some anxiety and ADHD. And basically in a short amount of time, things started to implode, where she went unfortunately into a full-blown mental health crisis. And I remember laying in bed with my husband, and we thought I can't do it all. And we made a decision for me to step back and take care of her. And it was hard. It was hard on me too, on my mental health journey, because I felt like I wasn't being a good parent. I wasn't being a good professional. And it was a very, very scary time in my family. Baruch Hashem, I made the right decision because I was there to take care of my kid, and no one can doubt that need. And I called it my sabbatical. That was my mental model for not working. So on my sabbatical, I tried to learn how to meditate. I tried to, exercise more. I got a therapist, all these different things. And fast forward to the end of this past summer, where I knew I was going to start networking. This is where No Shame on You comes in. And I have always had a connection with the founder of No Shame on You, Miriam Ament. We were in a fellowship together through JCC Chicago. Always loved her mission. And I thought, now that I'm feeling better and my kid is feeling better, one thing that I felt was very, very alone in the moment, in the height of the crisis. And I just wanted to offer my services to her. And I called her and I said, would you want to meet for coffee? And we met at Bon Coffee, and I told her my whole spiel. And I said, Miriam, I want to be a mentor. If any parent out there wants to talk to a relatively level-headed Jewish mom like me, I'm going to be there. I want to be there for them because I felt really alone. And thank goodness, quickly, I found a network of people who had similar experiences and I could talk about it and we could, support each other, but I had to do it on my own. So I wanted to offer that. And at the end of the conversation, Miriam said, I'm so sorry for what you've been through, but we're expanding. And would you like to come to No Shame on You? And that's how I ended up here, which I think is a shared experience on many, many levels, as many people know. So I started on, and No Shame on You was created by Miriam in 2014. It's a nonprofit that is designed to eliminate the stigma around mental health conditions in the Jewish community and beyond. And we do that through educational programs, through workshops with different organizations, with the public. We have incredible resources and tools, blogs and podcasts. And we also attend events, fairs, festivals, carnivals, handing out resources. So we do a lot of different things. And I'll talk a little bit about those things later, but we are not clinicians or direct service, but rather focused on education and materials and resources. So people who need the help can find it, or they can help support their friends and families in need. So that's a little bit about me. And there's no shame in having anxiety. And, I think I'm in the right spot.
Thank you so much for sharing, both Nina and Wendy. I can tell you also from my own experiences, I've had moments and times where I've also sought professional help as well. No shame on you.
No shame.
And it's been definitely instrumental in my own journey as well. I want to circle back to something that Wendy, you mentioned, but I'll start with you, Nina, that during the pandemic, there was this increase in mental health challenges in the community. I wanted to ask you, I guess both of you, we'll start with Nina. What did you see in your role about the mental health challenges that arose in the general population, the Jewish community here locally in Chicago? What challenge, what struggles did you see taking place and anything particular that you noticed?
Well, I'm going to tell you some statistics, but I actually want to start my comments. First of all, I want to thank Wendy for her courageous share, because we know from research actually that the surest way to break stigma is to tell your personal story. And so I really appreciate what you had to say. And I think that the folks listening and with us tonight probably appreciate it a great deal. I would say that at JCFS in our community services program, we right away, first of all, I think it was within the month that I actually was contacted by Miriam from No Shame on You to do a program for JUF, because the staff at JUF was absolutely anxiety ridden. They were grief struck and they were isolated. And so we right away I did my very first Zoom program with Miriam from No Shame on You, Miriam Ament. And then also with my colleagues at Community Services at JCFS, we put together a number of different programs, which I'll tell you about later in this program. But what I will say is that we tried very hard to meet the immediate needs of the community, which involved an increase in mental health reports, an increase in substance use, an increase in overdose, an increase in suicidal attempts. And in fact, I've got the numbers to prove it. So I always like to do contrasting statistics. So back in 2019, there's an annual survey that's done by the Substance Abuse and Mental Health Services Administration. It's called the National Survey on Drug Use and Health. And at the time, back in 2019, they found that 21% of Americans faced mental health issues. So that's about a fifth of us, right? Slightly more than a fifth. That was back in 2019, but they found when they started doing these surveys more into the pandemic, and I also looked at the CDC for some of these numbers and the Kaiser Family Foundation, that now we're up by 8%. So now we're at 29%, nearly a third of Americans are experiencing mental health issues, up from 21%. And the Kaiser Family Foundation actually found a jump of 40% in reports of anxiety and major depressive disorder. So really, and that's for people that are 18 years of age and up. So I'm not even talking about teenagers. And I have an interesting statistic with regard to that. The National Institute on Drug Abuse, NIDA, found that there's been an uptick of substance use. Some national measures, like the SAMHSA one that I mentioned earlier, is looking at an increase of close to 30%. An interesting statistic that I just alluded to is that teen substance use, at least in the first year of the pandemic, went down. I'm wondering if anyone can guess why. You can put it in the chat if you want. But if you think about it, they're stuck at home with their parents, right? Where are they going to go to, as we say on the street, cop some substances, right? They can't go out because they're restricted just like the adults were. No, they couldn't interact with one another. So for that first year, the substance use went significantly down. However, and you probably have read about it on the news, I know on CBS News tonight, just now, I saw a whole story on fentanyl. So you've probably heard about fentanyl. That has contributed to an increase, a 30% increase in overdoses, and over 100,000 deaths to overdose in 2021. And there's not a lot of studies specific to the Jewish community. The United Jewish Federation in New York did a comprehensive study and found that 1 in 5 Jewish adults experienced increased depression and anxiety since the beginning of the pandemic. And that gives me a chance to say what I often say is that while the Jewish community is unique and special in so many ways with regard to mental health and alcoholism, addiction, substance use, we're not so different, right? Just like in the general population, 1 in 8 to 10 of us might have a substance use problem. Same is true for the Jewish population. And the percentages for Jewish adults and youngsters experiencing mental health problems is about the same, very similar to the general population. So with that, I'm going to turn it over to Wendy with any information she has along the same lines.
Well, just personal anecdotes. I want to reiterate that the mental health crisis, as you mentioned, is on the rise pre-pandemic. And think of, I mentioned this before, but think of an ember when you're making a campfire, when you're going camping or in the backyard, and it's glowing just a little bit. Everyone's got their shtick, everyone's got their things. But the pandemic, what we have seen from community members that we've spoken to, and also personally in my personal life, is it just put gasoline on it, and it exacerbated it. And I think what I've learned since I've been at No Shame on You are the same kind of statistics, that between 1 in 4 and 1 in 5 people are affected by mental health challenges in a given year, which means half of the human population are affected by mental health issues at some point in their lifetime. So, more mental health challenges that might be diagnosable. And also, I think what we're seeing is a lot of stuff with teens and kids. A recent study just came up that many of you might have read, that 1/3 of teens have had a mental health crisis during the pandemic, and 46% of teens reporting feelings of ongoing sadness. And just to piggyback on that last statistic is 75% of mental health issues are developed by early adulthood. So it really is a hard time for the kids. So yeah, I'll close on that.
So it's obviously the numbers are frightening and real. And I would ask, what programs and services have you guys seen that have been most effective in providing support and helping alleviate? And I'll start with Wendy and then jump back to Nina.
So just to say again, No Shame on You does not provide what we call direct services, but we see ourselves as providing support and empowering people to seek help for themselves and for others. When the pandemic initially hit, we had to do what every other organization, had to do, which was pivot to virtual. And we found that model was incredibly nice, creating community and offerings in all different sorts of areas to help address it. We started doing a lot of programming around loneliness and isolation to address people's lack of control and whatnot. And we have been increasing our offerings since the pandemic start started to meet with increased demands. And really what I love about No Shame on You is that it's small and nimble. So we can really go out there and pivot and change to what particular congregations or schools or whoever needs. We have a large social media following of close to 125,000 followers, which is amazing. We serve the Jewish community and beyond. So we post about mental health issues to help normalize them. And really, the hashtag that I use the most is "You are not alone." Hashtag "You are not alone." And we have a lot of people who really appreciate that. And then one of the ongoing things that we do that has not shifted is every Tuesday we do a yoga session around mental health, around mental well-being. And it's really great. It's a half hour. It's no cost. And I have to tell you, I have to stay alert and not doing the yoga during those sessions because I'm letting people in. But it's so relaxing just to even hear the instructor's voice that I enjoy that, and it helps me. It's a mental health break for me. And we're continuing to do programming. Right now, this summer, we are actually doing 18 different summer camp trainings, which was a request. I think it's a natural fit for me because I was a camp director for 18 years, where we are working with summer camps to help their staff deal with their own stress. That's a whole new layer that we never even thought about 4 years ago. Staff mental health, staff burnout, what they can do to take care of themselves, as well as educating them on what to look out for in their campers, not to diagnose, but to learn what to be aware of so they can take it up the chain and alert their supervisors, parents, etc. So that's a little bit about things that have been really on the rise right now.
Very interesting. And what have you seen as far as being effective from a therapeutic and clinical perspective in addressing some of the issues?
Well, I actually mentioned earlier that I did a program with Miriam Ament at JUF, which really addressed all the feelings that people have been experiencing throughout the pandemic: the grief, isolation, anxiety, all of those things. And, that kind of developed a life of its own. I asked Miriam, is it okay? Can I, can this and take it on the road? And she said, sure. So I've been doing that program in just all different places for agencies, for synagogues, for a lot of different organizations. And what I found is that people really need to talk about what's going on. People, interestingly, I've even had some sort of counterintuitive things happen where people say, well, I'm grateful for the isolation of the pandemic. I'm not much of a people person. I like being isolated. So sometimes I would hear things and learn things about the community that I didn't expect to learn. So, and I've done, more than a dozen of programs like that. Another thing that community services has done, which I think is a real service to the community. Again, people really want to talk, but also people, I love that hashtag, "You're not alone," because also JCFS recognized that people were feeling alone and disconnected, and in one particular way, and that's in their experience of grief. People lost people through COVID, but just think about, any of you who lost anyone during the pandemic knew how hard it was to have a Zoom Shiva. That, was so difficult for so many people, and not being able to bring a meal or something to a loved one's home. So we did what we called evenings of support, where we invited the community, and really we broadened it to nationwide. So if someone from California wanted to attend one of our evenings of support, they did. And we did focus on issues related to grief. So for one evening of support, we did grief related to specifically to COVID. We did one evening of grief related to grief due to loss from suicide. And then we also did one related to grief due to overdose. And we're now doing that seasonally. We started out doing one every month, and now we're sort of sticking with the different seasons. We also developed programming for both mental health and what we call Serenity Shabbat, so special Shabbats, which actually Wendy and I did together at our shared synagogue, Temple Beth Israel. But we also developed a program called Serenity Shabbat, which is for people who are in recovery from substance use problems. I don't want to take up too much more time. I do want to share with you one of my most recent exciting ventures. It was my very first time that I was able to record a podcast with a group called Behind Our Door. Two friends of mine, Nancy Sussman and Julie Joyce. Nancy used to be the executive director for NAMI North Shore, the National Alliance on Mental Illness. And Julie actually is a Chicago police officer, and she runs their mental health training for the police officers. So she and Nancy get together and do this podcast on a fairly regular basis. And they asked me to do one of those podcasts. If any of you are on SoundCloud or Instagram, you can actually find it. And I did a program largely on addiction, but we actually kind of focused on dual diagnosis. And we talked a lot about how families can deal with their children's substance use and mental health problems. The beauty of podcasts, again, the reason I raised that, even though it wasn't specifically for COVID, it was another way to reach people when they are isolated, when they're stuck at home, when they're quarantined, which thankfully not too many of us are anymore. So there's a lot more going on at JCFS Community Services, but I think I'll turn it over.
Very interesting. Thank you very much. I want to move away from COVID for a second, but I'm actually, this is going to be a Nina focused question. I apologize for hitting you back to back, but I know you mentioned before, you mentioned that, we can reach out to you, which is amazing that both of you are here, real people in our community we can actually connect with. But practically speaking, a lot of us are just don't know how to navigate it. So if we are concerned either for ourselves or for others, what do we do to help them or help ourselves get help? What are the steps we take?
So wonderful question. It actually is the question I try and answer every day in my job. So, I'm not going to be able to teach you to be mental health specialists in this, short moment here, but there is no reason why anyone on this call or anyone that has concern for a loved one, a colleague, a professional associate that you work closely with, that you couldn't recognize a little bit of something about what's going on and then do something about it. The most important thing to recognize is when someone's functioning is beginning to suffer in some way that becomes obvious to you. Maybe it's their hygiene and the way they look. Maybe their hair is disheveled. Maybe they've got stains. When before they were, they looked absolutely like they jumped onto the cover of Vogue magazine and they always look perfect. All of a sudden, not so much. Their hair is disheveled. They have stains on their clothing. Maybe they are usually someone who's punctual and all of a sudden they're showing up tardy, right? They're not showing up on time. Or maybe you're used to sitting next to them at Friday night services and they're not there anymore. And it's not because of the pandemic, it's because they're just not showing, right? So you begin to notice, or maybe it's your relationship is faltering. Maybe they're being irritable and temperamental with you when before they were really even keel and cheerful people. Or maybe you notice that they have what's called a flat affect, like they just don't register any emotion in their face. Maybe they're doing physical things like rocking back and forth. Maybe they're trying to soothe themselves in some way. So there's a lot of things that you can be vigilant for, right? You can look for. So that's number one, is notice how is functioning changing? Is someone's behavior, or maybe they're expressing thoughts to you like, I feel so sad all the time. Or maybe they're actually expressing symptoms. Maybe they're saying things to you that, I can't get up anymore without a drink, or I can't get up anymore without some sort of painkiller, right? Gee, I'm a little worried, I've been using gummies a lot more than even the doctor told me I was supposed to. So maybe they're saying any number of those kinds of things to you. That's when you want to say something. And I am going to acknowledge to you right away, it's never easy to confront or talk to someone about these things, which we generally think of as private and personal. And in fact, if you kind of have the bravery to kind of jump in and try and help someone, they may say, leave me alone, I'm fine, right? But that should not deter you. So let me give you, it's not easy, but it is simple in the sense that it's just a 3-step approach. So the first step is, definitely if it's someone like a real loved one, like a child or a spouse or some sort of significant other, you can even start the conversation with, I love you so much. Or if it's not that close a relative or a friend, you might say, I really care about you. Or you might just simply say, I'm worried about you. So some sort of statement that acknowledges that you care about this other person and that you're concerned for their welfare. So that's one. Two is, I notice all those things I just mentioned. I notice that you're not coming to services like you used to. You're not coming to Minion like you used to. You might say, I notice that you drink now at parties when before you didn't. I mean, that's kind of feels already a little personal, but just something that you observe that's different from before, just making an observation, or just, you can say something as simple as, I notice that you really struggle when we're in groups. Are you feeling anxious, right? You might just go so far as to say, is it uncomfortable for you to be in a group? Because one thing I know, here's the secret. So that's number two. You want to tell people what you observe, but here's the secret. A lot of us are reluctant to ask that question. We're afraid of first of all, we're afraid of what we might hear, and maybe we won't know what to do about it. But the most important thing to recognize is people aren't really, I think Wendy would agree with this in her own experience, her own struggle. People really want to talk to someone. They just sometimes don't know if it's safe. So if you start your conversation off, as I recommended, with, I love you, I care about you, I'm worried about you, this is what I'm seeing going on with you, they may just bowl you over with how much they end up sharing. And then the third thing, of course, is, those are the first two steps. The third step is, how can I help you? What, I know about Nina Henry at JCFS. I know about Wendy Singer at No Shame on You. Rabbi Myers maybe knows some people and things that we can recommend. But basically, how can I help? Can I bring you a meal this weekend so that you don't have to deal with the kids? Anything like that. How can I help? And just be careful not to get too caught up, because sometimes when someone's really feeling lousy, they're going to latch on to someone and really kind of pull them in. So you want to have, pretty good boundaries. You want to make sure that if you feel like you're treading into an area where a professional needs to be, that's when you call me or Wendy, and I will be giving you some resources toward the end of the program. But definitely, that's the moment when you try and see, if they say, yes, please help, that you try and seek professional help if you don't think you on your own can give them adequate help. Did I cover everything? Anybody want to add to that?
I'll just add that if you are worried that someone is in an imminent danger of hurting themselves, you can take them to your local ER for an evaluation. That's one thing. You're not making a mistake. If it's your kid, you're not making a mistake. And sometimes you just don't know. If you can't get to the local ER, you can call 911. And in fact, in 2020, Congress designated a new code that can be used instead of 911 called 988. It's through the existing National Suicide Hotline, and it was approved in 2020, and it's launching on July 16th, 2022, and it will connect you with regional or local centers designed to support people in emotional distress. So even if you're questioning, you're not sure what to do, there's someone who's right there who's an expert. So that's a big deal.
I just want to add to that. Thank you. Yes, 988. And actually, if you call 988 with that friend, colleague, whoever it is that's with you, that's really struggling with suicidal thoughts and ideas, the National Suicide Hotline, they'll sit with you on the phone and walk with you through the process. They'll ask the right questions. They'll give you instructions about who to call, when to call. They'll tell you things like, don't leave the person who's expressing suicidal feelings alone. They're going to tell you a lot of things. And I just want to finish this little section with a story about a guy named Kevin Hines. He became famous actually through mental health first aid, which the training I've been doing on and off since 2010. And when he was about 17 years of age, he actually made a suicide attempt. He actually jumped off the Golden Gate Bridge. So he was pretty desperate, but when he tells his story, because he unbelievably survived that attempt, when he tells his story, he talks about how he was on the bus on his way to the Golden Gate Bridge. And he said, I was sitting in the back of the bus and I could see all the people sort of engaged in their day. And he said, I know I must have looked pretty desperate. I was really feeling really down. And he said, if anyone had asked me, are you okay? I wouldn't have made that attempt to harm myself. I would not have made that attempt to kill myself because I would have poured my heart out. So that just reinforces my point that never be afraid to ask someone if they're okay, especially if you notice that they are doing okay, because that will open the door to help. And that will open the door for them to just get something off their chest. I think that covers that.
For sure. That's superbly informative. And I think all of us can definitely, God willing, hopefully not so much, but, in the right situations, apply that information appropriately. And I guess moving that kind of that focus personally, all of us in our lives, we're all people, we're not robots. So we all have ups and downs. We all have times that we're happier and sadder and, everything in between. And the question I think a lot of us wonder and is, how do we know when we should be seeking professional help as opposed to just speaking to a friend or a family? And are there any specific life circumstances that someone may go through, whether it's, a death, a loss of a loved one, any other, potentially tragic or dramatic situations in life where there should be no matter what, everyone should seek help in this situation? I'm just I think a lot of us have trouble navigating that area. And what would you recommend in that regard?
So you want to start this one, Wendy?
Sure. So first off, I just want to say that you don't need to be in dire straits to seek support. You don't need to have a diagnosis of anything to seek support. Sometimes it is just nice to have a sounding board who's not your spouse or your best friend and not in your inner circle. So I think that's really important. And I just wanted to say that it's okay. It's okay. And it actually is pretty amazing. And it has been for me. I went to therapy when I was in my 20s, when I went through all of that, that first panic attack feeling. And then I didn't go back until I was 45 last year. And it really is just a sounding board who's not in my inner circle. And even though I'm feeling great and I'm doing great, I still like to check in with her every other week, and it works. And I'll
Nothing like a judgment-free zone, right? A place where you can go where someone has no axe to grind, no judgment. They're just there to listen to you and help you work through your problems. Generally, a therapist who's got chops will know that the biggest thing for them to do, I'm doing a lot of talking tonight, but generally when someone comes into my office and they want to talk to me and they want to have therapy, oftentimes I start a session by saying, so, and that's it. And then I stay quiet and they do the talking. And maybe I might guide them, in one direction or another, because I sense they're avoiding something or whatever. But back to Rabbi Meyer's question, I want to reference a really great book that I read back when I was I was going to say undergrad, but it was my master, as I was pursuing my master's. It's called Non-Finite Grief. And if people are interested in that, I can send Rabbi Myers the information. But what I love about that book is what the authors say right from the get-go is life is full of change. Life is full of loss. And it really is, in other words, yes, we grieve when someone who's dear to us passes away, right? Of course. But there's all other kinds of grief. A kid leaving home to go to college for the first time. College is often a really big trigger for kids that might have, be at some risk for some sort of mental health problem. Changing jobs. I had an experience when I left my last employer. I was with them for over 19 years, and they suddenly shut down my program because they had made some bad financial decisions at that organization. And it was no fault of my own. They shut down the program. They told me one day, and 6 weeks later, the program was gone. I was traumatized. I thought I was going to retire from that agency. I thought that was it. And, I don't think I got over the trauma of that experience until I was, I got my job at JCFS Chicago, thank goodness, around 6 days after that that other program closed, I started at JCFS 6 days later. So I was exceptionally fortunate to find JCFS. But I think my boss, Beth Fishman, would tell you, yeah, I think Nina was traumatized for about a year and a half after she got to us, because that job change, that loss of this place that I'd been going to for over 19 years was poof, gone inside of 6 weeks. And all of the clients I had relationships with, I had to sever. I had to find other places for them to go. So loss is, those of you, who maybe have experienced a divorce, that's a terrible loss for you, for your former spouse, definitely for your children. So loss, I think, is a very, very big piece. So loss on any, and just change, right? Life is so full of change. And finally, I think this is the obvious one, is sort of the elephant in the room, is the pandemic. Our lives, whatever normal was, I don't think we'll ever see again, right? Whatever our normal life was is poof, gone. Now we have, Zoom, right? And right before we started tonight, we were extolling the praises of Zoom because we get to reach you. But frankly, I really miss training a group of people where I can see their body language and I can hear their tone of voice and we can have interaction. I miss that, right? So then pandemic really kind of stole connection away from us and, changed everything, changed how often I didn't see my youngest daughter for, most of the first 2 years of the pandemic. So, yeah. So I'm going to shut up now and give Rabbi Myers a chance to cut me off and talk about something else.
Well, thank you so much, both of you. Really, so insightful. I want to ask one last question before I open the floor for anyone else to jump in. I think it's a question which perhaps we are familiar with, but not. I think we just want to hit the nail on the head. But this is for Wendy. Mental health stigma. What is it, and what are the responses that we as a community, as individuals, can do to help reduce it, just very practically?
Okay, so mental health stigma is when society and people places shame on people who live with mental illness, or people who don't live with mental illness but are seeking emotional, are having a hiccup, a bump in emotional distress, such as anxiety, depression, and any other bipolar, PTSD, post-traumatic stress disorder. So this has been going on forever. Just a quick history, which many may know or may not know, is that in the Middle Ages, this has been around for centuries, mental illness was considered a punishment by God. They thought people were possessed by demons and at times burned at the stake. This continued for centuries and centuries and centuries. One of the peak times in the stigmatization, I know from my work at Illinois Holocaust Museum, when during the Nazi reign, hundreds of thousands of mentally ill people were murdered or if not sterilized. So it's been around for a long time. There's social public perception of mental health. It's 3 parts: social and public perception, structural and systematic stigma, and also self-stigma. So the social public perception, which is not true, but it is what has been perceived, is that people with mental health illnesses are lazy, they're dangerous or violent. It's not the case. It's their family issues. They can't contribute to society. So lots of different stereotypes are built there. Then, because of this history of stigma, it's been a systematic piece of our history on so many levels. There are policies in government which make it hard for people to find housing, jobs, healthcare opportunities. People with certain mental health illnesses die an average of 25 years before the general population. 70% of those in the juvenile justice juvenile justice system have a mental health diagnosis, and until recently, mental health insurance did not cover it at all. So we don't normalize as a society proactive mental health care. We're starting to make some steps, but we are not there. And then because of that, when you're told over and over that that you're not going to get better and you're going to fail, and there's these horrible stereotypes, there's something called self-stigma, where you feel that shame on yourself. and you don't want to seek help, and you're hard on yourself. I say to my kid every day, be kind to your friends, be kind to your teachers, and be kind to yourself, and people aren't kind always to themselves. So how do we reduce it? One is through education. So just being here tonight, I commend you all. You're here, you're learning about it, you're talking about it. Two, model for your families taking care of your mental health. And I do that. I say, guys, I'm taking my 20 minutes to meditate right now, or I'm going on that bike to sweat off my energy. And my kids know that's important to me, where in the past, I totally ignored it, to be honest. Another way to help reduce stigma is language. Language is such an important thing. It's hard for everybody, including myself. I catch myself all the time by saying, maybe I catch myself saying that person's so crazy, or just being careful about what you say. I've heard people say, I'm so OCD, I have to have this so organized, or my ex-boyfriend is psycho. So just being careful of how you say things and being conscious of that language, just being conscious of it will help. Next is to advocate for those with mental health struggles. If you hear somebody making fun of somebody, to stand up for them, to teach your kids to do that, to be an upstander. And then, as Nina talked, that basic supporting those who experience mental health issues, as simple as saying, are you okay? Or can I pick you up dinner tonight? Those little things, those support makes it so important. And the mental model that I like to think about, and a question for the audience to ponder that we like to say at No Shame on You, is how would I behave or think if my friend had a broken leg? If you found out about that, you'd want to bring them some soup, you'd want to call and check on them, and just be there to support them if they need it. So mental health challenges deserve the same kind of compassion as physical illnesses.
100%. Before we jump into any questions from the audience, I just want to, first of all, once again, thank both Nina and Wendy for joining us this evening. I want to thank all of you. And I also want to thank Renee Silberman, who really spearheaded the origination of the program. And so we deeply always are grateful to Renee for all her efforts, and thank everyone else for joining us as well. I do want to say in response to what Wendy just said, which is that it's true from a general perspective, but also from a Torah perspective as well, that we've a mitzvah. There's a biblical commandment to take care of oneself, and it is clear if you examine rabbinic literature throughout the centuries that there is equal value and importance given to both one's physical health and one's emotional and mental health as well. And it really cannot be understated how important it is from a Jewish perspective to give the priority and the care and compassion that is necessary both for ourselves and others in our community who need that support and help. And that's what we're trying to do in our community here. We're trying to continue to build a supportive, loving, caring community in every way possible. And obviously being cognizant of people's mental health challenges is a huge piece in the puzzle, in the picture. So open the floor, and any questions from the audience, feel free to either unmute yourself or to type in the chat. I know I have some questions also. But I'll allow for anybody else.
I'm going to, in the meantime, while people are thinking, I'm going to put in the chat our website, noshameonyou.org. And I will let you know while you're thinking about questions, just to give you a moment, that we have a really cool program tomorrow night. It's called Faith and Hope During Times of Struggle. And it's a panel discussion with a Rabbi Avram Malotek, who is on the East Coast, and he has been labeled as one of the top 30 upcoming rabbis by the Jewish Forward, as well as a college student, and as well as another woman from the community, Sheila Siegel, who are going to talk about the relationship and the intersection between faith, Jewish thought, and all the things that come with it. So check it out on our website, or shoot me an email and I can send you the registration.
And I'm also throwing up my information. You can see my email, and I'm about to put my phone number out there too.
Amazing. So we do have a question that popped up. I want to thank Marsha for interesting question. She wrote, one of the current challenges is finding mental health providers that are covered by insurance. Do you have any advice on this issue?
What was that again?
One of the current challenges is finding mental health providers that are covered by insurance. Do you have any advice on this issue?
Yeah, I was actually trying to write my phone number, and so I apologize that I didn't follow the question. Actually, I have a resource sheet that I gave to Rabbi Myers. I'm not because it's not a PDF. I'm not able to put the link into the chat. So if you'll send it out to folks subsequent to tonight, that would be great. Most all hospital-based programs will take Medicare, and many of them do take Medicaid. As far as private insurance goes, really quite a few providers are taking a multiplicity. I mean, I know that most of the providers in the area take Blue Cross Blue Shield, take United Healthcare, and a number of others. So if you're struggling to find, it might be that some private practitioners are a little bit more difficult in that regard. So I would, if you're not finding a private practitioner, there are a lot of really excellent community mental health programs on the North Shore and in uptown Chicago in the upper, so there's just Thresholds, Trilogy, Community Counseling Centers of Chicago, where I used to work, Jocelyn Center, NICASA. Those are all community mental health centers that take most insurance. And so it's not necessarily a private practice, it's an agency based. And of course, JCFS Chicago takes Medicare, Medicaid, most private insurance, many private insurance carriers. And and that's actually a really good reason for calling or emailing me, because that's the kind of stuff that I can research for you as well. So if you have a particular kind of service that you want, I can help you find that and whether or not they take your insurance. So I really encourage people to get a hold of me, because many providers do take mental health. And I just read something I want to add. This is the last thing about telehealth. This might change as we kind of move away from pandemic, but basically Governor Pritzker of Illinois recently signed an executive order declaring telehealth or teletherapy services fully reimbursed by insurers. So just as if a patient goes into a doctor's office. So be aware, please, that if you're worried about not getting covered for telehealth services, according to Governor Pritzker, you should be covered. And I can, again, do additional research for folks if they want to find out more.
Thank you so much. Thank you so much. We're actually gonna, it is 7:30 and we don't want anyone to turn to any pumpkins. So we're gonna, first of all, once again, really thank Nina and Wendy and everyone for their time and joining us this evening. And we look forward to, God willing, as Wendy mentioned and Nina as well, that it's a journey. It's an individual journey. It's a community journey as we continue to hopefully become more aware, more compassionate, and build a more welcoming community for everybody. And specifically with our intent of being more sensitive and more in tune to our mental health challenges individually and communally. Thank you for joining us, and we wish everyone a lovely evening. A reminder that Mincha at Shul is at 7:45 p.m.
And I've also put in the chat, I don't know if you can see it, a link to our to an evaluation of this evening's program. I think Rabbi's also going to send that to you by email. So if you don't want to get in there now, don't worry about it. But I, for one, want to thank Rabbi Myers for this incredible opportunity. And please extend, I'll probably email her anyway, but please extend our thanks to Renee as well. And thanks to all of you for listening so politely. And next time, maybe you'll get into the mix and talk to us a little bit more.
Sounds great.
Yes, and I echo the same. Thank you, Rabbi Myers, and thank you, Renee, for inviting us.
Everyone, have a lovely evening. Lovely evening. Be well.
Good evening, everyone. Great to meet you via Zoom.
Thank you. Thank you.